My question is, can you guarantee the safety and the long-term health of people who take the vaccine?
Dr. Fauci?
You know, whenever you have an intervention, there's never a 100% guarantee, but I can tell you that the overwhelming evidence of data that we have now indicates that the vaccines, as we all know, are highly effective and really very, very safe. The chance of having a serious adverse event is minusculely small. So although there's no guarantee, there's a lot of confidence that it's safe.
All right, let's take another from this side of the theater.
Hello, my name is Carlos, and in January I contracted COVID. A week later, I got the monoclonal antibody therapy, and 4 days after that, I tested negative. Number one, is there any advantage to someone who's already gone through COVID and getting the vaccination? And second, are there any pre-existing conditions that can have an adverse effect as a result of getting any of the vaccinations?
Dr. Murthy, do you want to take that?
Sure. So, Carlos, first, thank you for your question. And I'm sorry to hear that you had COVID. I'm so glad that you've made it through. And it sounds like you're doing much better now. You're asking a great question. And it turns out, even if you've had COVID, it's still important that you get vaccinated. And the reason is because your body will build up an immune response from having COVID. But what we've learned is that the immune response, the protection that you get from the vaccine, is actually even stronger and more robust than what you get from being naturally infected. So that's why we're recommending that people get vaccinated, even if they've been sick before. And finally, to your question about other conditions like diabetes or high blood pressure, other conditions that people may have, you were wondering, could that in any way lead to more side effects with the vaccine? In fact, I would say it's the opposite. People who have other medical conditions are at greater risk of having bad outcomes with COVID, of being hospitalized or potentially dying from COVID. So it's even more important that they get vaccinated. And the fact that so many have is why we're seeing the number of cases, hospitalizations, and deaths drop in our country.
Many people want to know also, how long would that immunity last?
Well, we don't know, but we know it's at least several months. Likely considerably longer than that. And that's the reason why we're following large numbers of people to see what the level of the protection. It will stay like this, and it would likely start to come down over a period of time, which may be the reason why it is not surprising if we would need a booster at some time in the future.
Can I ask a question I've been getting from parents of small children down toward the age of 12? Will they get the same dose that an adult, a 200-pound, 6-foot adult would get?
The 12 to 15-year-olds will. When you get from 12 down, we do a dose de-escalation and an age de-escalation. So we go from 12 years to 9, 9 to 6, 6 to 2, and then 6 months to 2 years. As you get down to the lower ages, the dose will be diminished.
Okay.
Thank you, Dr. Fauci. We have another question over there.
Hi, my name is Karina. I have 3 children between the ages of 10 and 15. And ideally, we would like to get them vaccinated, but we'd prefer if it was FDA approved. So my question is, do you know the timeline for FDA approval for children? Since it was authorized later than for adults, will FDA approval happen at the same time for adults and children, or later for children?
Who would like to respond?
Well, the 12 to 15, we're there. So right now, the recommendation of the ACP that was just recently done is that children at that age can get vaccinated. The approval for the younger will depend on the clinical trials that we're doing right now. So as soon as the trials are finished, what the companies will do will be submit to the FDA to try and extend the approval the same way that we just did with the 12 to 15-year-olds.
But for your children who are 12 or older, you don't have to wait now. Now you can go ahead and get those children vaccinated.
Dr.
And Karina, I, as a parent, I also relate to you. I've got 2 kids as well. They're not as old as your kids. They're 3 and 4, so I've got to wait for a vaccine to be available to them. But and I can understand why you'd want to consider, the full approval. But here's one thing I would say about one reason why I would encourage parents who've got kids who are 12 and up to go ahead and get vaccinated now, especially now that the FDA and the CDC have weighed in and said this is something kids should get. It's because we now have really good data that's telling us that these vaccines work in kids to protect them, and the rate of adverse effects is extraordinarily low. In fact, the most common side effects that the children were experiencing were temporary muscle aches, fatigue, and fever that lasted a couple of days and then went away. What they were left with was protection. The other thing I just want to emphasize is that we hear a lot that the risk of COVID in kids in terms of bad outcomes is low, right? And that's true. The kids do much better than older folks do. But if we look at our experience, we've had a lot of kids who've gotten sick. We've had 13,000 kids who've been hospitalized in the age 12 to 17 age range. We've had 127 who have died. This is not a benign thing. It's not harmless in children either. So when we compare the risks and the benefits, the risks are really, really low. The benefits are really, really high. And this vaccine, it turns out, is a way that our kids can get back to seeing their grandparents, celebrating birthdays with friends, having sleepovers, dinners, and other things with their friends, and ultimately getting back to their way of life.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.